Hi everyone, I'm Dr. Rahul Gupta, Senior Interventional Cardiologist at Apollo, practicing in Mumbai and Navi, Mumbai, and Director of Cardium Advanced Heart Care Clinic, Vashi. Today I'm going to discuss the procedure of angioplasty. Angioplasty is a procedure where we remove the severe blockages in the heart without open heart surgery. So it is done through two routes as we discussed in the angiography, either through the wrist artery or through the artery in the upper part of the thigh, which is the groin area. So during the before the angioplasty, we see that the proper medications have been given to the patient, his blood thinners have been on or not, and then the patient undergoes certain blood tests like CBC, creatinine. A patient is admitted on the same day of the angioplasty or day prior and is kept nil by mouth for about 6 hours. Patient goes on the table, cath lab table. Local anesthesia is given either in the wrist or the leg from where we are going to perform the procedure. And then we take the catheter inside. There is a sheath which is put, just as we put the saline as we have done in the angiography. Through the same route, a guide catheter is taken, which is about 2 millimeter in diameter, and it sits near the origin of the artery of the heart. And through this, we pass a wire. Now, this wire has to cross across the block, because once the wire crosses the block, then we take a balloon over that block. So the wire acts like a rail system, and over this the balloon is taken. When the balloon is taken, the balloon inflates. We inject the dye, the balloon inflates and pushes the block sidewards. Then we take the stent into it and decide based on what is the length of the block. We take the size of the stent and the diameter of the stent is chosen, and then the stent is inflated. Once we have inflated the stent, we remove the stent balloon. If it needs further work like dilating it further, making it much bigger, more bigger than what it is originally is, then we do that, and then the procedure is completed. We can remove the sheath then and there itself if it is through the radial artery, or sometimes we keep it for some duration if we have done through the leg artery, and then we remove it after some time. The patient is kept in the ICU for the first 24 hours. And then in a ward for about 24 hours, and then usually we can discharge. In some other circumstances where patient needs prolonged monitoring ICU, the ICU stay will increase. So this is how the angioplasty procedure is done. It is, if done in a good infrastructure with good skilled hand, I think it's a very, very safe procedure. Thank you.